me? All right, all right. Thank you, thank you, thank you. Before we get started, I would just like to thank you all for joining us. My name is Jahmeer Reynolds. I'm the founder and executive director of the Marin County Cooperation Team. Welcome to our Southern Marin Community Response Team meeting, zone meeting number 52, which is really, really major for us. This has been going on for a couple of years now. Before we get started with if there are any new people at the cookout, is what we like to call it. This is a family gathering. Before we get started, I wanted to address something. We have an initiative going on around testing for diabetes and a myriad of other things. How many of you folks know if you're diabetic or not? How many of you know that if you have a clean bill of health? And I just don't mean diabetes or anything else. What about in your circle? Do you know if everyone in your circle has been tested, right? So here we believe in having a community response. That's why the name goes so well. We have to hold our loved ones accountable to make sure they have a clean bill of health. I'm going to tell a story. Something just happened recently that a friend of my sister's, 42-year-old man, said he wasn't feeling well on Thursday. He passed away on Sunday. Okay, and he did die from COVID, right? But we also know, but even in the Black community, what exacerbates COVID is our underlying health issues. And we continue to ignore them. 25% of African Americans over the age of 65 have been diagnosed with diabetes and everything else. And I'm even going to speak to HIV and AIDS. Most cases, 40% of the cases are people over the age of 50, I believe, in the Black community. So we are running around here, scared to really find out what's going on before we even catch it. Another story is my father thought he had a nasal infection. Didn't go to the doctors. He just kept using Flonase and everything else until one day he went to the doctors. My father had cancer in his nasal passages. They took my father's eye because the cancer got on his optic nerve. I sat in the hospital in Camden, New Jersey. I'm from Trenton, New Jersey, for a 19-hour surgery. They took my father's eye. He came out. He had to wear a mask for his chemo because all the radiation was going to his face. Fast forward, I go home, not even a year later. 2 days before his birthday, about July 14th, I'm sitting in that same doctor's office in Camden, New Jersey. I asked the doctor, how long does my father have to live? 3 weeks. That same day, my father took his last chemo treatment. And the funny thing is that no one was in there with him. And I prayed over my father and I said goodbye to him. My father passed away August 2nd of 2019. My father was only 58 years old. But because him not going to the doctors and thinking it's something else, it led to his ultimate demise. We are currently doing STI testing with this organization, along with diabetes and so many other things. If we want to live and make a conscious contribution to society, we have to be healthy. We have to hold our loved ones responsible for finding out what is going on with them. If it's a cough, if you are a man, you are over 40, you need to have a colonoscopy. You need to go get a yearly physical. If you have children and you don't do it, that's selfish on your part. So again, I wanted us to ground us in that, especially in our community. Didn't mean to seem so doom and gloom, but again, time waits for no man. And so with that being said, again, I'd just like to welcome you to our Southern Marin Community Response Zone meeting number 52. We always do this in the beginning. We like to find out who's at the cookout and if you put raisins in your potato salad. It's got to be illegal. Please share your name, your organization, and what brings you to this work.
We've got Karina here.
Oh, go ahead, Karina. I'm sorry.
Can you?
Oh, here you go. Okay.
Hi, I'll try not to talk too loud because, as I was already saying, I'm from the Midwest. I do not put raisins in my potato salad, but I love boiled eggs in my
Here
potato
we
salad.
go. Okay.
So don't give me potato salad without boiled eggs.
Okay.
My name is Karina Cobflesh. I am from Kaiser Permanente. I'm very happy and excited to be here, and I'm here in order to talk about how we can continue to support this community, this organization, and how we can partner in the future.
All right.
Good morning, everyone. Itamar Bixter. I'm also from Kaiser Permanente. I'll eat whatever potato salad Karina gives me. I'm also here to continue the work that we started last month and to continue to partner with everyone and to support all the good work that's happening. Thank you.
All right. Thank you. Is there anyone else in the room? We all family.
Go next. I know there's folks in the room, and just in case, I don't want to interrupt anyone that's in person, but I'm Andrea Garcia. I'm from Kaiser Permanente. I am the community health manager, and I lead our work externally for KP and across Sonoma and Marin counties. And I'm going to be sharing a little bit more about our community health needs assessment work along with my colleagues that are there, I believe, in person to share more about potentially partnering on some of the clinic work. Happy to be here today.
But she did not say. You didn't say you didn't put raisins in your potato salad. Come on.
Oh my gosh. Okay, I don't put raisins.
Okay, all right.
I don't put sweet pickle either. I only use dill.
Okay, we move it. All right, anybody else? Brother Art, I see you. Art Taylor?
Yes, can you hear me?
Yes, sir.
Hi, good morning, everyone. My name is Art Taylor. I'm a Chief Strategy and Program Officer at Rising Sun Center for Opportunity in Oakland. I'm here because I'm interested in understanding some of the issues and concerns in the Marin area, and I'm glad to be here.
All right, thank you. Art,
yes.
So the raisins, brother, do you put the raisins? Come on now.
Raisins in potato salad?
Yeah.
He's like, that's a question?
That's ridiculous.
My man. All right. All right.
I'm with the lady right before. Dill pickle, no sweet pickle.
Okay, there we go. All right. Anybody else that's new? All right. Okay. All right, everyone. Please share any updates on your community works, events, big wins. Adriana, there are people that do that. I just want to put that out there. We already know we got two people going. Manny, you can go first, then Mira Lisa.
Hi, good morning, everybody. Hope everyone's doing well. So there's a couple of things I wanted to share. I wanted to share that I'm going to start off with participatory budgeting. Wanted to say that the results are going to be formally announced today at 2 p.m. At the Board of Supervisors meeting. I also wanted to take this time to say congratulations to 3 projects from Marin City Youth Leadership from Wise Choices, the School to Life project from MCCT, and also Black and Brown Youth Theater from Griot Theater Company. They were one of the top vote getters and will be receiving TV grants. The announcement will be made today. Hopefully, folks can come out and support us as well as the recipients. There will be 2 members from our committee who will share the process, their experiences, and also some of the thought process that went into the participatory budgeting. So just to give a quick summary, participatory budgeting is a democracy for folks to determine how to spend a portion of a public budget. Normally public budgets get decided by department heads behind closed doors. Public never has a say-so in how those funds get allocated. This is the first time that it's been used in Marin County. It's very successful. Happy to say that there will be a second PB cycle in the future. At this time, we don't know exactly if it'll be next year or if it'll be in a few years from now, but definitely there will be a second cycle. And also wanted to share that even though the presentation, the formal announcement is this afternoon at 2 p.m. on our website, our participatory budgeting website, it does have live the interactive map that shows the 16 projects that will be funded, and they range from youth programs to transportation programs to housing programs to employment reentry programs. So very diverse, a lot of support. And also it does have the list of all the recipients.
Who is that? Can
I
you
gotta mute it,
mute
don't
yourself? Thank you. All right.
And as far as the potato salad question, I don't
All
put
right. Okay.
raisins. I am guilty of putting hot sauce in my potato salad.
You put what on it, Manny? You said hot
Hot
sauce.
sauce.
Hot sauce.
Okay. I thought you were about to say raisins.
Yeah. Yes. Hot sauce.
Manny, you lost like 2 street cred points. Just 2. You lost 2 street cred points, but you good though. All right. Next up.
I see.
Hi, everybody. Good morning. I'm going to make an announcement about this Saturday at the Mazanita Rec Center. There's going to be a Mardi Gras party hosted by the Marin City Community Service District from 6 o'clock p.m. till 10 o'clock p.m. Live music, king cake, crowning the king and queen, celebrating Black history. Pastor Leggett is on. He's going to announce about the upcoming Black history through First Missionary Baptist Church. And also, I do not put raisins in my potato salad.
Yes.
I put the Holy Trinity and sweet dill pickle relish.
All right.
Sweet
Cool.
pickle relish.
All right.
Yes.
Thank you. Praise the Lord. You know.
Amen.
Okay.
Amen.
Oh.
Alexis with Philly's Vsalt Cafe. Good morning. I would like to make an announcement for a win. I am part of the MCCT's CBI culinary program, and we had the opportunity for Andy Naja Reese to reach out to Dr. Reynolds to refer us to cater the short film that we had at the Jewish Community Center last weekend. Just say it was a win. I was able to put some soul on a culture menu, and it was great. So please enjoy our hot breakfast we have. I have some. Thank you.
Tell them what you got. Tell them what you got.
Some fresh pressed watermelon juice that's good for blood pressure and all the good stuff. You should try it. It's good for collagen in your skin. Also have some artichoke water. It's nice for you. Give you a good flesh. I have a hot breakfast: scrambled eggs, croissants, bacon, roasted potatoes, orange juice, lemon ginger water. Anyway, the list goes on. So I'm glad whoever's here, you did get a treat this morning. So thanks for coming. So thanks. Shout out to MCC.
See? Look. Now they get y'all all online hungry right now. All right. Is there any please share any events, big wins, all that good stuff?
I know Adriana had her hand up.
Adriana, I know you've been busy with the weather.
Yeah, that's what I'm going to talk about. So not a big win, but hopefully you all survived the storms. I just wanted to share 2 things. One is that in incidents and disasters like what we experienced this weekend, Marin VOAD puts out information and just sort of reaches out to everybody, reaches out to nonprofit partners to see how everyone's doing, to see if they need anything. If you are not on my distribution list and you would like to be, I'll stick my email in the chat. By all means, this is an open barbecue. Everybody's welcome, as Jahmeer might say. So let me know. But now, following the storms, what the VOAD does is we will help the county identify damage assessments. And so if anybody has damage to their property, whether it's an individual property or an organizational property, again, I'm going to stick my email in the chat. Feel free to email me. And pictures help. Description of what's been damaged is helpful. But what that means is the county is looking for initial damage assessments so that they can submit that information to the state, and the governor might declare an emergency, which then helps with Marin County getting funding back into our hands to help with repairing roads and houses that might have been destroyed, nonprofit facilities that might have been flooded. So I just want to put that out there, because that is what the VOAD does after disasters, is we do try to help assess what our nonprofits are going through. And that can be a community center, that can be a library, it can be schools. It's, the facilities that are going to be overlooked because Department of Public Works is going to be looking at the roads. And not everybody is thinking about our nonprofit partners, but the VOAD works with all of you specifically for this reason. So I'm going to stick my email in the chat. If you have damage assessments or damages, or if you know of some damages, please, by all means, email me, because the more we can collect this information, the better it serves Marin County. And then the hope is that money can come back into those hands where people have experienced damages.
All right.
And as for potato salad, I feel like I'm missing out because I clearly don't eat enough potato salad. So maybe y'all can have a potato salad, cook off, and then I can let you know what I think of raisins.
All right.
That's my 2 cents.
All right. Is there anyone else? Paul?
Yes, I have a quick question, because there was a home damaged here in Marin City pretty badly by a tree that fell. And so, and yes, they're trying to figure out like what direction. It's a family home. Nobody was staying in there at the time, which was,
Lucky.
thank you.
Yeah.
Thank God nobody was living there at the time. But the man that's like over the estate, he's trying to figure out like what's his next steps, because he didn't know. So can I have him contact you?
Yeah, let's start that way, and hopefully I can find somebody to put him in touch with. Terry reached out to me about that. But let's talk offline.
All right.
Okay, thank you.
Of course.
All right. We have one more announcement. If there are any other announcements, please put them in the chat. Go ahead. Come on, Shannon. Introduce yourself.
Yes, my name is Shannon Bynum. I just want to say a big win, big celebration was Sunday night. MCCT went to a comedy show that was hosted by the Kappas. Thanks to Jahmeer for appreciating Staff Wellness Day. We really appreciate that. And it's a big win because we were able to start off our week with a positive note. So thank you. That's a big win.
All right. Thank you. Thank you. Lots of laughs. All right. So we're going to turn it over to who's next.
Oh, it's Shannon again.
Oh. Well, while he's coming up, you come up here. Let you all know what the School to Life project was for the participatory budget that we won. Our goal was to provide mentors for students who have IEPs and 504s to disrupt the special education to prison pipeline. It is particularly focused on young people of color, to be more specific, young African Americans, because we are basically incarcerated at a higher rate. We are misdiagnosed and overly medicated. Over 70% of the California prison population reads at a 4th grade level, and African Americans represent about 1 million of those individuals who are incarcerated. So it is our goal to meet the youth at grade 3, where basically prisons start tracking, the justice system starts tracking these kids, looking at behavior incidents, grades, and so many other things. And our job with the Schools of Life Project, excuse my language, ain't no kids in here, is to cut that shit off where it's at. All right. So I just thank you all. Please enjoy the meeting.
So $1 million across the country?
$1
million across the country?
Mm-hmm.
Okay.
Mm-hmm.
I was gonna say, that's California. No. We really got a
Right.
Yeah, for real. All right. It's me again, Shannon Bynum. So it won't be like a long, drawn out thing, but what I would like to do for those of the partners that are online, if we can just put in the chat, well, let me back up. So we are still running the Alert Marin campaign. We are hoping and absolutely targeted on getting a lot of people signed up to get more alerts. It is a collaboration, so all of our paid partners here you have on the screen, please put it in the chat the location that is best for us, for myself to come out and collaborate and work as a team to get more people signed up. Yeah, we're just looking to identify the location that we can meet up. I feel like I'm saying it over and over again, but until we start getting things in the chat,
Right.
then I may have to. Sorry for anybody that's in the room.
People can come off mute too.
Yeah, we just want to get this locked in. We want to make sure that we are being intentional with our collaboration, partnership, as well as all of our efforts that goes into this.
You got a hand up.
We got a hand up.
Mm-hmm.
The Adriana?
Yeah, just a question. Are you also getting people signed up for Nixle at the same time?
Oh, yeah. So for those who don't know, Alert Marin and Nixle, let me just show really quick. 1 second. Some may not know what the card looks like. We have them in different languages. So some of you have seen it. Actually, shout out to Leah. She's in the room. We got a bunch of postcards that came back. So this is what the card looks like. And just like Adriana mentioned, you have a side with Alert Marin as well as Nixle. So who knows about these? Okay. We got some hands up in the room. How about on the chat? Who knows about Alert Marin and Nixle? I see one hand. Okay, I see two hands. So quick overview, excuse me. Alert Marin is specifically made to take action. So in case of a wildfire and evacuation, during the event that evacuation routes, shelters, and transportation, what you would do is you would scan the QR code that's located on the card. Super easy, super manageable to do. Everybody has a smartphone. On the other side, you said not everybody? Oh, I can help who doesn't. So Nixle is made to be aware. So in case of, it sends out general public safety information, road closures, police activity. No lie, y'all, if you get signed up, you got a lot of alerts on Sunday.
Right.
Because they were coming in on Sunday. With the weather picking up and it's being really rainy outside and storm. Oh, good. Okay, we got some. Okay.
And Pastor Floyd's on his way. So we'll ask him when he's here.
Okay. Yes, absolutely. So yeah, this is really good to get signed up for, especially during the stormy season. If you would like to, sorry, excuse me. Let me just back up. So with Nixle, the sign up is a quick, easy text to the number below, 888-777. Super easy to do. If you need help, please reach out.
That's 415-888.
No, so actually there is no 411. You just text your zip code to that number. And whatever area you're in, that's the alerts that you'll get coming to your phone. Would you like to?
Yeah, so
hand her the.
Oh, sorry.
Not that I need it. Hi, everyone. Thank you. I feel like my mum can hear me across the Atlantic. I don't need a microphone. So just to give this group a heads up, on March 23rd, there will be a county-wide test of Alert Marin. So this is the time to sign up for Alert Marin. Now, when you go online and you create your account, you want to prioritize your cell phone because the alerts go out quickest through the cell phone network. You know, we do the cell phone, then we'll send an email, then we'll try a landline. But if we can get your cell phone first, that's the quickest way for you to get an alert. So take the time now to do this because you don't want to miss out on the test. You're going to get FOMO on March the 23rd. So don't be that person that says, oh, I didn't get the alert. And what we did see over this weekend on social media were lots of people saying, I didn't get alerts. I got alerts from San Francisco. I got alerts from Sonoma, wherever. Now is the time. If you think I've already registered, just go and do it again, right? We're not going to ping you twice. Just go and do it again. I can't stress that enough. And I've just got data for how many people signed up this weekend, which is really interesting. Okay. And so we'll continue to feed that data back to this group as we see events happening across Marin City to see where the uptick is. We'll see it like in real time. Okay. That was it.
All right.
March 23rd.
And making sure folks sign up for all the locations that are relevant, like the zip codes, right? So I got like Central Marin and Southern Marin because I work here. But
I would really just because some people, you know, everyone's busy with their time. Focus on just getting the Alert Marin signed up, okay? And just start with that. It's going to take you like 2 to 3 minutes, and then you're done. Then we can get hold of you. That ends my PSA.
Thank you.
Oh, Elaine Wilkinson, Office of Emergency Management.
there's a question or comment in the chat from Maria. I got alerts from both, but what is confusing is that they all come in through the same text number. Yeah. We need to look at who's sending the alert. Well, it's all coming from OEM.
It's all coming from OEM.
Yeah.
Okay.
Oh, welcome, Pastor
Good
Floyd.
morning, Pastor Floyd. Good morning. Okay, so I believe that is, let's see, we coming through the chat. Okay, Pastor Leggett, good to see you on.
Okay, cool. Okay, Megan's gonna check to see about upcoming events. She said she's gonna promote it within their current folks and their programs in terms of signups. Pastor Leggett saying at the church, cool.
Okay.
Is Paul still on? He's there, but we can.
Paul is still
I don't know
on.
if he's still able to. You know, he does a million things at once. Let's see. You feel like you got what you need, Shannon?
Yeah, and I for the rest of the people, we could just connect offline. Thank you for your time. Thank you for the input. Thank you for being intentional with our collaboration. So that'll be all for me.
Thanks, Shannon.
You're welcome.
All right. Okay. So we are going to transition into our main event, our special guest, which is Kaiser. We're so grateful that you are going. Sorry, technical situations here. That you are here with us to discuss how we can better partner and enhance our services here in the area. And I just want to ground us on how this all came to be and what we've been able to accomplish together. You know, when COVID clinics kind of shut down, when it came to county support, we turned to Kaiser and Safeway in our December clinic to see what was possible. And so Kaiser was able to provide COVID, flu, and RSV vaccines, preventative screenings, and our team was there as well to do STI testing, tabling, you know, which has a number of test offerings within it. And then, you know, it was super successful, right? So we were able to get 24 COVID boosters, 7 high-dose flu, 11 regular flu, RSV, 25. And really the preventative screenings was a real positive for us in our community. So the blood draws and blood pressure readings were great. And, you know, diabetes diagnosis and treatment were made on the spot. So just really want to come together to have Kaiser talk about,
these types of things that they're able to offer, anything additional, and then really hear from the community about what we want, right, and what Kaiser can potentially bring in. So really wanted to thank you all for being here, and I will let you take it away and stop sharing this so folks can see each other.
All right, I'll try not to talk too loud. Hi again, I'll reintroduce myself. I'm Karina Kopflesh from Kaiser, and I am the Community Wellness Manager. And thank you for having us here. We're really excited to be here, and I love the energy of this group. And I love the potato salad question, because I just realized I haven't had potato salad in so long, and it made me really hungry. So I'm glad there's breakfast. I'll let you introduce.
Yeah, good morning again. Idamar Bixer. I also work with Karina at Kaiser Permanente. I'm an associate medical group administrator, and part of my work includes the vaccination efforts that Kaiser has in Marin. So very proud of the work that we did last month, or in December rather, and looking forward to continuing that work and expanding in that work and offering more and more vaccination and preventative health education, just about everything. We're very excited about that.
Awesome. And we do have a colleague online that I'll just let her reintroduce, or at least retouch on her.
Andrea.
I don't see you, Andrea,
She's
but
there.
I know you're there.
She's right behind you. That's why.
You're right behind
Yeah.
me.
My square won't pop up, but Andrea Garcia, Community Health Manager across Sonoma, Marin County.
All right. So really, we wanted to keep this super conversational. I didn't want to come with, a dog and pony show. I just wanted to be real with you. And talk about the things that we can do. We are very excited about this prospect of working in the community, but please understand, just right off the bat, we are not as nimble as some smaller organizations. So what we are going to do is try our best, and we have a tendency to get creative in Marin. So we're kind of known for that in Kaiser, and we are very committed to our community work. So we have a new, I would be remiss if I didn't mention, we have a new, I don't know if any of you have ever met or know Pat Kendall. I'm not sure in this group, but she was our medical group administrator for over 50 years. And so we have a brand new, over just about 6 months, medical group administrator. Her name's Armika Berkeley. And one of the things that she is interested in doing is recommitting to the community and finding the pockets where we haven't been as saturated. And so we're very, very happy that you invited us in. So what we did at the last event, thanks to Pastor Floyd and this group, is really, really huge for us, because one of our goals is to close gaps when it comes to vaccines and preventive screenings. I really resonated with where are you, Jahmeer?
He'll be back.
Oh, okay.
Yeah.
I really resonated with what I was like, is he not in the room? Did he change? I know he's always sharply dressed. So I was like, maybe he has a couple outfit changes during screening. I don't know. So I really resonated with what Jahmeer said, because we are super interested in supporting your diabetes work as well.
Great.
I saw your testing kits, and that's something that we are very interested in doing in this community, and closing care gaps is what we call it. So aside from vaccines, we also look at preventive screening. Is anyone in here a Kaiser member? Okay. Have you gotten those? I'm so sorry, because you probably have. The emails and the calls and the emails and the calls, like you're due for this, you're due for that. And we recognize it's very hard for people to always get to us to do those things. So one of the things that we offer is sending people out to you to do those things.
Okay.
So we will come and we will do blood pressure screenings, and we will check our system to see what you're due for and help you schedule appointments. We can hand out fit kits, which are our colon cancer prevention kits, right? So hopefully you won't have to have a colonoscopy if you're able to take your fit kit, and then you're not really necessarily due for one if the fit kit clears you. So that's nice. Yes.
Colleen, I have a question about the fit kit.
Yes.
And a lot of folks are not comfortable putting that to use. So what could we say to people to make them more at ease at using that kit? Right?
I love that question.
I mean, I would say prevention. I would say, doing a fit kit, and really it's just a matter of getting that small sample and putting it in the mail and sending it back. I mean, you could find out ahead of time if there's any risk for colon cancer, which we find a lot of cancers that we find that people have most likely originated in the colon. There's a lot of colon cancer, a lot of prevention. We've done a lot of great work with preventative care around that. And that prevents you from necessarily having to come into a colonoscopy, or it at least prompts the providers to call you in for one.
What I'm getting to is that yuck factor.
Yeah.
That's the point that we've got to deal with, right?
So,
how do we get past that?
Yeah. So what I typically say is, okay, I'm going to be really. Would you rather put a little sample on a card, or would you rather take a drink that's going to make you go to the bathroom all day for a whole day and then go and get a tube shoved up your butt? I mean, let's be real, right?
That's the real deal.
Yeah. I mean, the fit kits were designed to help minimize colonoscopies that aren't necessary, because it does involve making someone go. I mean, has anyone ever had to drink that drink that they make you do beforehand? It's not fun. It flushes you out. Let's say that, right? And then
don't taste good.
It doesn't taste good either, and you have to drink a lot of it. It's like a gallon or something. And then you have to go into the medical facility, and that's a cost for some of us, right? And then you have to go into a procedure room. You have to get knocked out. So it's kind of a balance. You want a yuck, or you want that all? Yeah.
Okay, hold on.
I'll help you with the mic.
We got Pastor Floyd.
Oh yeah.
Let me. I know you're loud, but.
Yeah. Yeah, they can hear me in the room.
Like you're a pastor.
Not in.
Okay,
I
not in
appreciate
church.
it. So real quickly, and I think Pastor Leggett would be on this one too. We have several folks that do food pantries all over the community. Is there any way to and so I think I forgot the percentage of people in Marin County that takes advantage of those food pantries, but it's over half, right? So the question is, can you do some of those services around those food pantry? Because it's been very good. I always compliment, Ida, because what she's done, and now the library is now going to, start being in a food pantry to do books. It seems to me, it's all their mobile units, that's another advantage, because we do know that people are already going to come. They're going to take care of those services, and it's also not only for information, but actually for all of those prevention services. So I was wondering whether you thought about that or can get that together. And again, that's I think there's 4 or 5 of them, so it almost one every week in terms of getting services to people.
Anyone else over here before I?
Okay. Get your steps in.
Again, getting my exercise.
So I'll just quickly comment. Thanks for that question, Pastor Floyd, because that's actually what we're hoping to hear today, is how we can help. So it's our preference to have you kind of be like, here's where we want you. Can you do this? Rather than us say, here's what we can offer. You shape it around us. So, I mean, obviously we have to, and I'll let Itamar speak to this, we have to be a little thoughtful about our resources, but I do hope that this starts the conversation about you inviting us to things, because that's really what we want. You all are the experts. You already have things happening in the community. We don't need to come in and be like, here, look at this special Kaiser thing, because that's not necessary, right? We'll come to you.
Yeah, I agree. I think there's a lot of different services we can offer, so I think it's important to identify what is the need in any specific event. It also helps us to know sort of numbers, so we can get all the logistics, get the various people that need to come out to help us do that, whether our nurses or LVNs or MAs to come out do injections and so forth. Maybe it's just colorectal kits. Maybe it's just blood sugar checks, maybe blood pressure checks. So knowing that ahead of time is wonderful, but we want to be able to be that. I mean, we're not as nimble as we'd like to be, but we can be, especially in this community. I think that's the beauty of especially if Kaiser San Rafael, we're small and we can be that way. And we definitely want to be able to show up where you need us to be and kind of, target those things that you want us to target.
Yeah.
Another question.
Thanks, Karina.
The question is, do you not need to be a Kaiser member? I mean, Kaiser is not freely giving services to folks who are not Kaiser members.
Thank you for asking.
Unless I'm wrong.
No, thank you for asking that question. So yes and okay. So for a lot of the services, the preventive services and the vaccinations, for the most part, with the exception of maybe flu, we do want you to be a Kaiser member, mostly because we already have your information. You know what I mean? We want, if you're due for a preventive screening, we're going to know that, and that's very important to us. We try our best to serve the non-Kaiser members, because what we don't like is turning people away. That doesn't feel good to us. One second, Pastor Floyd, I see you. But it doesn't feel good to us to turn people away. We don't like that. So what we typically do with people who are non-members is we bring as much resources as we can to also serve them. So education, resources that direct them to y'all, right? Maybe having your testing kits with us or having you partner with us. We love partnering. We often partner with like Safeway or Golden Gate Pharmacy or things like that. So thank you for that question. You want to?
Yeah, I would only add that I think, yeah, as you said, the education piece is definitely something we can offer to anybody. You know, blood pressure checks we can offer to anybody. Sometimes when it comes to labs, you know, colorectal kits, those kits that use in the fit kits, and so labs that get sent into a lab, and so you would need to have a medical record number. And then if God forbid something does show up, we need to be able to follow up with somebody. And so that's somewhat of the issue with non-Kaiser folks. But when it comes to education and things like blood pressure checks and like telling people, even helping with blood sugar checks, any of that stuff, we are 100% involved, and we would absolutely support that.
I'm coming to you, Pastor Floyd.
I'll go after. Quick question, and this may be a little. I also wanted to say thank you to Ms. Garcia, who's actually on the online.
We're gonna give her time.
Yeah, I want to appreciate that, because some of the folks in the room actually have taken the first mental health first aid through her generosity. But okay, this is a bigger question. Bernard Kyson was a very good friend of mine, and when he was at Kaiser, he had this thing about community health, which allowed this kind of thing, is what you were talking about, a little bit more partnership that isn't driven by membership, right? Because it was like, if the whole community is healthier, our costs go down, blah, blah, blah. So where are you on that? Because I think since his death, and there's no shade on the new people, I'm just not clear where you are, because I think it'll change what we ask of you, because it was so open with him and where you guys were. And so I don't think we were clear. And I know you guys were trying to figure all this out and all that. So I needed to kind of figure out where you are in that philosophy, which is what Ida was coming at too, because we don't want to be asking you things and then being frustrated that they're not deliverable, or that we are then telling people, we go back to our organizations and every place and say, hey, Kaiser really wants to help. And then we say something and you're like, well, you know, we got to pay for that, you know, kind of thing. So again, so I'm trying to figure out where you are. If some of you know about Tyson, in what happens, where are you in that whole community healthcare thing right now, so that we can ask the right questions and resources.
Thank you, Pastor Floyd. And thank you for bringing up Bernard Kyson. Amazing man. We miss him. Yeah, and I first of all, we'll never agree to something that we're going to make you pay for. We would never ask you to do that. So we are still very community focused and community minded. I think the best person to kind of touch on this, are you still behind me, Andrea?
Yep.
Is Andrea.
Yes, I'm still here. Can you hear me?
Yes. Speak up.
Okay. I think also what Pastor Floyd is referencing is there's always this toggle in community health of what we can do in kind by staffing events like this in person, and then financial support we're able to provide through grant making or sponsorships. So that was some of the information that I was going to share with the group today, because it's really based on our triennial community health needs assessment. And that's work we've done in collaboration with Healthy Marin Partnership for a number of years. And so we're getting ready to launch our 2025 CHNA. When we identify the needs, each medical center, including Marin Health and Sutter I'll prioritize which health needs that they'll address. And then from there, it creates an implementation strategy, or what we call an action plan, of which needs we're going to try to target with our grant making. Our grant making is expended on a calendar year basis. And typically we do an invite only process in the beginning of the year, and then an open invitation or open RFP process later on in the year. And I can share that's like the June, July timeframe. If folks are interested in being added to a distribution list to be able to receive that information, please feel free to reach out. I'm happy to work with our public affairs team to have you added. So then that way you have the opportunity to receive those notifications of when those opportunities are open. And that includes sponsorships as well. Sponsorships are also offered on twice a year basis to apply for an event or an initiative that's going on, something even like, community health fairs to be able to support in the community as well.
Do you want to go over, Andrea, I don't know if you're prepared for this. Do you want to touch on the categories for?
I do.
Why don't you go ahead and do your while you're
Okay.
Okay.
The only thing is that I have my screen sharing disabled. So if somebody could allow me sharing permission, then I can share
You should be
some
good
slides
now,
that I
Mary
have.
says.
Try again.
Try
Should be
again.
Good now.
Okay. There we go. No, I'm not the best at Zoom, so be patient with me so I can.
We're used to Teams.
Yeah. Okay. Can you see the presentation?
Yes.
Okay. Perfect. Okay, I'm going to skip through some of these quickly just for time because I know that we're at 10:21 already. And just so that, it touches a little bit on what I just shared with the group as well. The community health work that both Karina and team are doing in the community locally, and also what we're doing here with our community health work and the grant making space and, regionally with, with our colleagues based out of Oakland is all part of our mission driven work. And like I mentioned, our community health needs assessment process is conducted every 3 years. We don't do this alone, and nor can we. We partner with the other hospitals to do it. It is an IRS requirement as a not-for-profit healthcare system, but we've been doing this work in collaboration with Healthy Marin Partnership for a number of years, informally since 1998, and then the first documented community health needs assessment that was conducted together in 2002. And so when I talk about our San Rafael area, or San Rafael service area, that actually includes Marin County plus the cities of Petaluma and Sonoma. And then this is a little bit of a breakdown or framing out of how this process works, because it's a triennial report that needs to be published every 3 years, but the process is really a little bit lengthy for valuable reasons. It's about an 18-month process, and where we conduct these health needs assessment across all of our service areas. We collect, data, primary data, meaning directly from stakeholders and folks in the community, and then couple that with secondary data or publicly available data, and that creates what's called our community health needs assessment. That could be a list that ranges anywhere from 8 to 12 different health needs, and then we have a selection of the priority health needs from each healthcare system. And that creates what's called kind of our action report or implementation strategy report, and that informs our grant making for the next 3 years until the next needs assessment is published. So in our last round for the community health needs assessment, this is a list of some of the partners that we included, with some of the key informant interviews and group interviews. We partnered with a consulting firm called Harder & Company to conduct this research. I will preface that it was challenging, but we did our best to have a variety of organizations that were included because of the fact that we were still collecting this data in 2021 in the midst of COVID, and still having precautions and having challenges of meeting in person. The The reports themselves, I'm happy to share the links with Mira and the team so that they can be shared out with the rest of the group. But this is just a data point as an example of a neighborhood deprivation index. We can look at it for all of San Rafael, and then when we layer it by zip code with our communities of color, and we see that's where we see more disparities. And there's just a quote from one of the nonprofit leaders that was interviewed for the education health need. But with that, these are the categories that Karina was referencing. So for San Rafael Medical Center, we prioritize the 4 health needs that you see in front of you, but also structural racism, which is identified as the top health need. That means we weave that into all these 4 health needs because we're targeting the communities that are most vulnerable, that are providing direct services to the communities that need services the most. So this is where we see our grant making come into fashion in a way that's not really general operating. It really needs to be program specific because they're targeting not only these health needs, but also the strategies that are aligned with them. I'm not going to go into these one by one just for the sake of time, but again, I can share copies of the reports and along with a copy of my slides so that you can see how we're supporting income and employment, and then access to care, which is inevitable, right? As part of a healthcare organization, we're doing charitable healthcare coverage. We're providing health fairs or vaccines in the community, but we also want to support organizations that are doing screening and eligibility for healthcare coverage. And so you can imagine that right now, what we call the great unwinding, there are a lot of folks that are falling off of their healthcare coverage, losing Medi-Cal or not renewing it, or maybe now qualify for it that hadn't before. And we want to be able to get them the application assistance and enrollment that's needed. Again, mental and behavioral health, this is a key area for San Rafael. It's focused on trauma-informed approaches. And really what's, I would say Kaiser has been a pioneer in the adverse childhood experiences studies that were released early on. And so one of the things that we were able to do in Marin City that Pastor Floyd referenced was be able to fund some of the youth mental health first aid trainings along with adult. The more folks that we have trained in the community, the better we can utilize those that are trained to be able to identify and refer folks appropriately to services and care. And then complemented as a subcategory would be substance use and prevention. And then last but not least is education. I do like to point this out because across Sonoma and Marin, this is a unique health need. There are no other medical centers across Northern California for Kaiser Permanente that prioritize this health need because we see such big disparities in access to early childhood education. So those are our littles that are 0 to 4. And then also high school graduation attainment and the support for the students that are maybe missed the opportunity. We have a whole generation in high school that missed preschool education opportunities that need help to improve their high school attendance, their graduation rates, their support for being first generation college students. I could go into much more because I really wanted to talk about a free resource that is a closed loop referral platform. But I want to be cognizant of time since it's 10:27 because I can always, hopefully, if the group allows it, I can always come back and share this free resource as well that's open to community-based organizations.
And does that help? Yes, okay. Yeah, and I think too, what we learned in the the December 19th clinic is having multiple health providers there to deal with the issue that's been addressed, right? So we need Safeway there, we need Golden, I can't remember who you referenced, but like the reason why we reached out to you is because Maria, who's on the call, she took her father to get a COVID vaccine and he's very elderly and he was turned away, right? So we want to bring everyone to the table in addition to Kaiser so that as many folks as possible don't get turned away because they're not a Kaiser member or they, whatever, based on whatever insurance needs. So I think also having a really clear list of what you can offer preventatively to members and non-members would be super helpful for our outreach.
Yeah, I can send that over, definitely. And I can include, it's basically what we talked about today, the preventive services, the vaccines, the education. But I also want to say we also have this like ability, hopefully, to work with you to be a little creative. So if you're like, we have this thing that we're thinking about addressing, we can be a really good thought partner, and maybe we can't lead it or do all the work, but we can at least help or be a connector. So I can send that over. So I know we're at time. Jahmeer, you're up here, so.
No, first of all, can we give the folks from Kaiser a hand? Thank you so much. Thank you so much. So what I wanted to make a suggestion even to your marketing team and those who want to come do business in Marin City, why don't you send a ground team to come get to know the people? Yeah. Like come sit, have either Pastor Floyd walk you through the community, stop at, the rec center or the CDC or CSD, because oftentimes organizations want to come into Marin City and haven't even done their homework to be welcomed. And so now you have the pushback because my question to you would be, who in the hell are you and why are you here? And is this another survey? And if you're going to take this information for a survey, where are you sending it to? Are you just going to be like everyone else, come and do this experiment, put our names and check a demographic box off that you work with Black people in Marin City, and we don't hear from you anymore? Like Marin City is a place that you have to be welcomed in because it's been done so wrong for so long. And now the corner is turning and there's someone at the gate waiting saying, hold up, what are your intentions? And so, I really just wanted to, to lift that. And I always like to end with a quote. Honesty pays, but it doesn't seem to pay enough to suit some people. Okay. And also, for those who pertaining to business, just let your yes be your yes and no be your no. Because when you imply maybe, when really the answer is no, you leave hope lingering in the air, and we're grasping for something that does not exist. Mm-hmm. So if you cannot do it, it's fine, but we can find a way to do it. And sometimes the best capital is human capital. You may not have the funding, but do you have access to a network that can bring in doctors and therapists and so many other things to provide services pro bono? So again, I just really want to thank you all for coming in and just doing this great presentation. Thank you, Pastor Floyd, for connecting us. Thank you, Ida, for representing the county, and April and Elaine and Leah. Brother Phil representing the school district. He is the community school director. I would like to suggest that you get with Phil too. I know you all have the Thrive campaign with Kaiser. We want to make sure that our babies are taken care of as well. And so again, just thank you. What's up?
I was gonna say, just
you see what's on the board? Paid partners. If we cutting you a check, we need that data. So, I could say it professionally and everything else, but we need the data because we here in the Southern Marin CRT believe in efficiency and reporting out to the community what we're doing, what we're going to do, and what we have yet to achieve. Okay.
Everyone's just thanking you and Kaiser.
Cool.
And everything's
all right.
Great.
Outreach day, Thursday, 10 a.m. All right. If you need we're going to have a metrics refresher, and we're going to have a discussion with the grocery outlet, which is fantastic, opening on 3-7. It's much more than a grocery store. It's changing the economic trajectory of Marin City by providing jobs and other opportunities. So it's a lot deeper than just a grocery store opening. Also,
taking applications at the church today from 10 to 2 and tomorrow from 10 to 2. They extended it one more week. We've got 65 applications so far.
All right. I don't know if y'all heard that, but if y'all know somebody, maybe somebody sitting on your couch saying it's hard to find a job out here, you go to the church from 10 to 2, fill out an application, get a job, and get off either couch. All right. All right, everyone. Thank you. Have a great day.